But the other piece that you talked about from hopefully alleviating burnout, of course there's managing it, but there's also alleviating it, is this team-based approach. Maybe you can speak a little
Yeah.
bit more about this integrated team-based approach, which I think is quite interesting. And for instance, maybe we can layer on top of that, is there a role for a nurse, what's the term for nurse practitioners to be a part of that overall
Yes.
care system as well?
Absolutely. We love nurse practitioners on our teams. There's such a great complement to the physician, and the way we can divide our work is wonderful. And then the way we can collaborate. And sometimes when you have a tricky situation, to have that other person who has a slightly different training, different perspective to share their expertise can be so wonderful. So team-based care is beneficial in a few ways. First, it's just beneficial because we can share the patient load. We can increase the number of people who can be seen by that one clinic, that one family doctor. But I think also what I'm saying is it reduces some of the mental load from the physician because they've got those different experts. I don't have nearly as much nutrition training as a dietitian. And so just knowing that I can send them to that dietitian is so helpful. Or like I said, we also had a pharmacist. And sometimes I was trying to figure out, what medications are covered by the First Nations Inuit Health Branch, which ones aren't covered. Well, she just knew and had a system and could look it up. And so we could find, and doctors often don't even know how much medications cost. And so sometimes I was just like, oh, what's the cheapest of these options? Because clinically they're pretty similar. And so I had a pharmacist who could be like, oh, rabeprazole is your cheapest drug for heartburn. So yes, you can give esomeprazole. It's a new fancier one, but it's way more expensive. And just having that person that I could share information with was so incredibly helpful. We also had nurses, we had physiotherapists, an occupational therapist. So I sent a lot of patients when they had, pregnancy related joint pain to see our physiotherapist, because there's not really much they need from me as the doctor. We just need them to do some strengthening exercises and get them through this pregnancy so that their body can recuperate afterwards. So sometimes they would come in and not see me at all. They just would come in, see the physio, get some attention on their hip, go home, and then see me at the next visit. So this is helpful for the physician. It's great for the patient because they just get the care from the right person at the right time. And then the key part is that we have to share a space, we have to share a health record, because when we're working in silos, that it's not a team anymore. We're not able to share our expertise. Instead, we're going to be duplicating our efforts. The pharmacist who works at the pharmacy might prescribe something for a urinary tract infection, but I know they've actually had 3 other urinary tract infections or bladder infections this year, and that medication's not going to work. So we need to be working together where we share a health record, we share space, we can talk to each other. But that is excellent for burnout, it's excellent for patient care, and it's more efficient.
And actually, just while you're just speaking about this, I kind of came up with a little bit of an analogy in my head, because I assume some people may be thinking, oh, you know what, like doctors, like why do you need so many people? Shouldn't you know everything? I
Mm,
want care from you, right? But I just thought about this. It's like a restaurant. A restaurant is like a team of people that serves an individual. Can you imagine if the chef was the only person had to take your order? They're also one that had to give you the bill. They had to come give you the water and then go back and cook. It'd take forever, right?
yeah.
Like it would be a terrible experience in some ways, right? Unless the flip side would be you would pay a lot, right? If you went to a restaurant that the chef did everything, right? They could only serve a very finite amount of people, and it would cost like $10,000 for that dinner, right? So
Yeah,
it's
that's a great
kind of
analogy.
interesting that like in some ways a team, it just makes sense. Like everything else you kind of service you get in life, you have a team that's really actually helps you and serves you. Like why shouldn't medical kind of medicine
Mhm.
be done that way as well?
And we have actually surveyed patients. And so we know that people they all want a family doctor. So telling them, like, oh, you'll just have somebody else, that they don't love that idea. But what they also tell us is they're very happy to see other members of the team when it's a team-based approach. So that's clear. People are very comfortable with the idea of a team. They want to know that the family doctor is there because sometimes they're going to need that care, and having that link and that person who is trained to do the more complex diagnostics. And I mean, family docs are amazing diagnosticians, is what we call, because they take somebody who comes in with the most vague health issues and have to just figure it out amongst everything it could possibly be. And very few specialists have to do that. And so having them on the team is really core. But the nurse practitioners are really strong at things like preventative care. They do such a good job and they're more cost effective. when they're working in a team with physicians at providing some of that care and taking that off the plate of the physician. So I think they work really, really well together, where they can have the nurse practitioner can provide a ton of the care. The majority of care for many patients can be dealt with by the nurse practitioner, but having that physician there to help when something gets complex is also less stressful for the nurse practitioner.